Hello, my name is Nicole Rain, and I am a student at Indiana State University in the LPN to BSN program. This is a presentation about asthma and how to manage asthma. The following presentation is specifically intended for individuals that have been diagnosed with asthma. After watching this presentation, viewers should be able to accomplish 4 specific learning objectives. They should be able to identify 4 common asthma symptoms. They should be able to list the 3 different zones of the asthma action plan. They should be able to identify 6 ways to maintain a healthy lifestyle and identify 7 common asthma triggers. Please stop here to take the pretest to assess your knowledge about asthma and asthma management by clicking the link at the beginning of this YouTube video. The CDC estimates that 25 million people are affected by asthma. What is asthma? Asthma is a chronic lung disease affecting the airways. It causes recurring episodes of wheezing, shortness of breath, chest tightness, and coughing, usually in the morning or at nighttime. If an individual has asthma, they have it all the time, but asthma attacks or exacerbations occur only when something bothers the lungs. It is known that if someone in the family of a person who has asthma, other family members are more likely to have asthma too. In most cases, the cause of asthma is unknown, and there is currently no cure. However, it can be controlled. Asthma can be managed by knowing the warning signs of an attack or an exacerbation, avoiding asthma triggers, and establishing with a treating provider. Goals of asthma management include achieving and maintaining control of symptoms, maintaining normal activity levels and exercising regularly, maintaining pulmonary function results as close to normal as possible, preventing asthma attacks or asthma exacerbations, avoiding adverse effects from asthma medications, and preventing asthma mortality. Once diagnosed with asthma, you should work with your treating physician to learn how to manage it yourself. You and your physician should create an asthma action plan that works for you. An asthma action plan is a written personalized treatment plan document that describes the following: how to identify allergens or irritants to avoid, how to recognize and control asthma attacks or exacerbations, which medicines to take and when to take them, when to call your doctor or present to the ER, and who to contact in an emergency. This is an example of an asthma action plan. As you can see, it is broken into 3 different zones. The green zone is for when your asthma is controlled and you are doing well. The yellow zone is for when your asthma symptoms are getting worse. And the red zone is when you are having an asthma exacerbation and it is in a medical emergency. When managing your asthma, it is important to know your asthma triggers. Asthma triggers are things that worsen your asthma symptoms. If you know that your asthma symptoms occur when you are exposed to specific triggers, it may be sensible to decrease your exposure to those triggers. Allergens, such as dust, mice, cockroaches, pets, mold, trees, grass, weeds, and pollen, are common triggers for asthma. Other triggers include emotional stress. Emotional stress, such as intense anger, crying, or laughing, can cause hyperventilation and airway narrowing, triggering an asthma attack. Infections or illness. Getting the flu vaccine each year to help prevent influenza can be important in managing your asthma. Medications. Some people who have severe asthma may be sensitive to medicines and may experience serious respiratory problems when taking these medicines. Poor air quality or cold air, pollution, or certain kinds of weather, such as thunderstorms, can affect the air quality. Pollution can include indoor pollution caused by gases from inefficient cooking or heating devices that are not vented. Outdoor air pollution may be hard to avoid, but you can try to avoid it by keeping your windows closed. Another trigger is tobacco smoke, including secondhand smoke. So you should avoid smoke as much as possible. And finally, a less common trigger is food or food additives. Routine medical care is important when managing your asthma. Individuals should meet with their treating providers on a routine basis to determine if current treatment plan is working, to adjust their treatment plan if needed, or to complete regular pulmonary function testing. Peak flow meters are a device that allow individuals to assess the status of their asthma. Individuals who use peak flow meters should do so frequently, and many physicians require peak flow meter use for individuals who have severe asthma. Individuals who use peak flow meters should check their peak flow numbers every morning, every evening, after an attack or exacerbation, and before inhaling certain medications. The results should then be recorded in a peak flow chart like the one on this slide. Maintaining a healthy lifestyle is important for managing asthma. Ways to do this are maintaining a healthy weight, eating heart-healthy foods, getting regular physical activity, managing stress, avoiding smoke, and getting quality sleep. Please stop here. Take the post test to assess your knowledge about asthma and asthma management by clicking the link at the beginning of this YouTube video. For access to this flyer about asthma management, click the link at the beginning of this YouTube video. Included are the references I utilized in making this asthma management presentation. Thanks for listening, and I hope you enjoyed.